Hello, everybody. Welcome to the Living Well podcast. My name is Dr. Edward Perin. I am a psychologist in the great state of Ohio. Joining me is my co-host and lovely producer, Pablo Madrigal. So
Everybody.
today we're gonna do something a little different. We Pablo and I sat down and we spoke about maybe trying segments or alternative ways to give you guys a great show. He had an idea of a reaction video and he found something on YouTube. I only watched a minute or two of it. But we're gonna hopefully react to it. Hopefully it's gonna be funny. Hopefully we're gonna laugh more than we're gonna cry. But I I can't wait to see it.
Yeah, so me being an absolute YouTube fiend, this came up on my feed, and I thought it was very interesting and also very relevant to the things that we've been talking about here in the show in terms of just psychotherapy, therapy as in mental health on around, but also patient and therapist relationship. So I thought this video was really fascinating. Also, the OP of the channel is super entertaining. So we're gonna watch this. I'm really interested and curious to see what you have to say and take it from there, right? So ready?
No, I'm interested to hear what he has to say because I think the only time I've seen him before, he was reviewing, frozen pizzas, so I'm really curious to see what he has to say about psychotherapy.
Amongst other things, this man has a range, okay? He has
Okay.
range.
He seems charismatic.
Oh
I do
yeah.
admire his charisma. Yeah,
Okay,
let's
here we
give it a
go.
shot.
I like it. Okay, here we go. All right, we're gonna start with this guy. Here we go.
Uh,
Welcome back to the Papa Mate channel. How you doing? How you doing? Come on in and sit on down because today we're going to be talking about psychiatrists. People are meant to feel a type of relief when visiting a mental health professional. Not only does it allow us to vent out life's frustrations, but we often look at our psychiatrist as a kind, friendly figure. At least to some. Sometimes this dynamic can become a little more intense with patients catching romantic feelings for the other person. And today we're going to talk about an example of just that. Something that has taken the internet by storm. Of course, I'm referring to Kendra's psychiatrist love story.
yeah. Oh, yeah.
Have
I'm a
you heard about this
I
before?
I I know a little bit about, the Kendra story. I do think it is important to clarify, I myself am a psychologist. My license is to practice psychology. I use the talking cure. We w My focus is on change in behavior, change in outlook, often through self-exploration and self-knowledge. The therapist in this case is a psychiatrist who is a physician. They went through medical school. So the primary focus of their training is on medication and the application of physiological or biological interventions. So I just want to get this out of the way that they are he is talking about a physician, a relationship with one's physician.
A 38-year-old, attractive, smart, extremely successful psychiatrist, but he did not date. So even though I usually wear contacts, I'm wearing these espresso glasses in these videos because just in case he sees them ever, he'll see me in his favorite glasses. He did tell me he likes the turtle shell. So he didn't ever ask me to give him sexual content. Did that on my own when I would try to name the dynamic and the tension that was there between us that he himself manufactured and built. And then he would rage at me and tell me that I was wrong. And then I proceeded to give him 30 minutes of non-stop content about my intimate life with my boyfriend. And I actually recorded the whole thing because I was so excited about it. I accidentally said my psychiatrist's first name in one of my videos. If you clocked it, good for you. I do not owe him anonymity. So while I was mid crash out, I had just started using this tool, ChatGPT, who I immediately named.
Oh yeah, that's gonna turn out great.
I just talked to him about how obsessed I was with this man, with my psychiatrist, and I would just be like, I've told him I have a crush on him. Do you think he's gay?
Well, man, or initial
Yeah.
reactions. Initial reactions. Initial
Well,
thoughts.
this is one of the most common things that happens in a therapeutic relationship. We call it erotic transference. It's when a lot of erotic feelings or romantic feelings are transferred onto a clinical, you know, ideally very platonic professional relationship. But of course it would. Very often, therapeutic relationship, these are people who are accepting you in your totality, and sometimes you are sharing with them things that are very intimate, things that you wouldn't share with another person. Feelings tend to develop. Now, there is kind of a bit of a gender difference. So, like, male erotic transference to female clinicians I don't have to deal with very often. I will occasionally get erotic transference from male clients, but my heart really does go out to my female colleagues because it's very overt and it's very clear. And my female peers who are very well trained in transference work will sometimes just like blank face. Oh, you're saying that you want to have sex with me? It sounds like you're trying to say that you want to have sex with me. They'll go, oh no, no, oh, blah, blah, blah. But that is part of the relational content that unfolds and becomes part of the therapy. Female to male erotic transference is often more romantic than sexual. It's, this person is reliable. This person I can talk to about anything. I can share 30 minutes of intimate sexual details about my boyfriend, that tends to develop more into a romantic love than a sexual love. So, I am seeing my initial response is, she is clearly developing romantic feelings for her therapist, and the therapist is at least attempting to work with or through that erotic transference. But you can hear how she interpreted that. He's making me feel this way. He's making me do these things. Big red flag.
Yeah,
Big red flag. We don't
that's
make
tough.
you do anything. If he's doing his job right, he will be reflecting the erotic transference.
Yeah, that's toughy. I also want to give a big shout out to Papa Meat's editing team. I mean, this is really also for it's October, right? Spooky season.
Sure.
Fittingly a scary story. All right, so
Well, that's good to know because we don't have an editor yet. So, like, we need to know what makes a good editor for a show.
oh yeah,
If this is good example, maybe I'll also
well
try to
this is a
criticize
little bit
his cinematography.
this is a little more cartoony than what we were trying to do. But anyway, here we go.
Now, for those who don't know Kendra, she uploaded a big, long story time-esque video series about how her psychiatrist was falling in love with her. Kendra Hilty,
Yeah,
the
that's the
36-year-old
direction that I'm
ADHD
picking up
coach,
on.
yoga instructor, and TikToker from Arizona, she recently shared a 25-part series of videos recounting her strange relationship with her psychiatrist. What began as a mission to go back on ADHD medication spiraled into a chaotic, one-sided love story that sent people into an uproar. Kendra's reason for retelling this story, according to her, was to paint the psychiatrist as a groomer and a predator that manipulated her for his own emotional and sexual desires. And in the first video, she explains her belief that some
Probably
men
not
are
them.
so emotionally dead inside that they go into psychiatry to avoid feeling their own feelings and to, quote, emotionally feed off their mostly female patients.
All right, can you pause this?
Yeah.
So, this is very heavily technical, but when I talk about this being an erotic transference, that is one of many different forms of a transference. Now, transference in general is attributing relational or putting relational attributes onto somebody who did not create that relational attribute. So I'm a male, I have a beard, I have at least some gray hair. If I work with somebody who's 18, 19, 20 years old, I could generate fatherly transference, right? They may be more likely to respond to me the way they might respond to their father. And then I might notice that the responses are a little weird because I'm not their dad. And, we're more on an equal footing in a therapeutic relationship. If someone's closer to my age, I might give off little brother transference, right? So if I work with somebody who's maybe 5 years older than me, maybe some part of our rapport might get playful, and he might be treating me the way he might be treating his younger sibling. And then I might go, hey, this is weird. I'm not acting this way. Why are you doing that? We reveal what relational attributes are being more or less projected onto us, or more transferred onto us. So when she's saying the psychiatrist was grooming me within his intentions were that he himself is lonely and misguided or manipulative, right? She is ascribing intentions onto what we would call a blank screen. He's not giving any indication, right? He's just sitting back, maybe asking questions about her medication because he's a prescriber. And she is going, "Oh, he's in love with me. Oh, he's grooming me. Oh, he's mining me for sexual content because he wants to hear how I have sex with my boyfriend." All of that is being transferred onto him from her imagination.
So I think it's important to highlight that that's where the difference between a therapist and a psychiatrist, a psychologist and a psychiatrist lies,
Well,
right? I mean, you're listening because you're probably going to give the feedback. A psychiatrist is probably listening because he's making an actual a physician kind of level of medical diagnosis.
a lot of times, I actually don't know if this is a psychiatrist who's also trying to do psychotherapy. There are some still out there. There has been kind of a movement in psychiatry over the last 50 years, what they've been calling their physicians first movement, is that they are physicians first. They focus on their role as physicians before their focus on their subspecialty, which used to be psychotherapy. Um, Psychiatrists would go through a psychotherapy, often a psychoanalytic component of med school training to become a psychiatrist. That doesn't exist anymore. They have to go out of their way in addition to their medical school training to get psychotherapy training. And some do. Some pursue that. And some of them are some of the best therapists that I've met. But it is a small percentage of psychiatrists. Most of them meet with a patient for 20 or 30 minutes, and it's to get information to inform their med management.
Cool.
So I don't know if he's actually doing therapy with her.
Well, we're going to learn.
Well, I wanna before you hit play again, I wanna highlight that it's not always a negative transference. If I hear a patient talking about how wonderful their therapist is, that they're this miracle who can cure cancer, and like they always say the right thing at the right time, and that everyone should go to them and they should charge $1,000 an hour, I listen to that with the same amount of skepticism as I listen to her say he's a grooming, malintented sociopath, right?
Mhm.
That can also be a transference. My wise and brilliant genius of a therapist gave me another profound magical insight today. Did he, or was that just a normal session of therapy?
Interesting.
Yeah.
Yeah. It's always a spectrum, right? It's never this.
Well, that's the relational transference, right? So if they themselves expect to see an expert with wisdom and knowledge to impart wisdom and knowledge, they might go, "Oh, he's so wise, he's so knowledgeable." And then the therapist might be scratching their head going like, "Man, I forgot I forgot to pick up my kid at soccer practice yesterday. Like I'm not that great."
Right. Right.
But it's hard to explain what a transference is, but it often comes from other relationships. And
Right.
the person who receives the transference, in this case, the psychiatrist, they feel different. They're like, "Oh, this feels funny. You're treating me like someone else in your life. I wonder what that's about." It is an
Mhm.
uncomfortable feeling to sit in a room during a transference, especially an
Yeah.
erotic transference.
Oh my goodness. I can't even imagine. Well, that's
Themselves look like the wounded healers, as well as fulfill their own personal fantasies.
There are so many people, especially men, that are emotionally dead inside that feel called to going into psychiatry so they don't have to feel their feelings, but they can feed off of the vulnerability of their mostly female.
shots fired.
So right away,
Yeah.
kind of like, what the fuck? This guy sounds like a dickhead. Doesn't he? When you go into it, she's just like, yeah, as a guy he was a predatory kind of, It all seems very just like you're listening in on this person.
I read his mind and it's terrible.
It's compelling. And then it seems that Kendra shows her real face, I guess is what I want to say. When Kendra Google searched psychiatrist in her city, clicking on the very first link she saw, what followed was a 90-minute intake, which is a meeting conducted to assess a patient's mental health status.
90 minutes is a good
what
intake.
exactly they need. You hear about what they're feeling, the problems, and then the person can assess what they feel is the best trajectory. And you can basically say yes or no through their diagnosis, their plan. She was quick to notice that the man was quite the looker. Kendra described him as a 38-year-old, attractive, smart, and extremely successful psychiatrist who had been in the field for 12 years. To make things easier, we're going to refer to him as Dr. Michael, or Dr. Mike. Kendra unloaded about her daddy issues, relationship trauma, past substance abuse, and more. After
Daddy
stilling her
issues,
emotions,
first flag.
Dr. Michael prescribed her with non-stimulant ADHD medication with the intentions of seeing her once a month to see how she was progressing.
What's a
Seems
non-stimulant
fairly
ADHD
innocent. Seems like
medication?
good prognosis. You know what I mean? She went in for this thing.
Pills
She
for
got it.
mood
And
disorder,
now
maybe?
she gets someone to come in every once
I
in a
don't
while.
know.
Like, just how you doing? How you holding up?
Probably a
Right?
low
Which, right off the
SSRI.
bat, Kendra was hooked on how charming and funny he was. The only reason I'm like, was where was the humor in that? Like, where I want to know,
Right.
just for me personally, professionally, how did he insert humor? She's like, yeah, so my dad, whatever. Just like, oh. He's like, stand up real quick. He stands up and he like puts a whoopee cushion under her.
Women just think you're funny if you're hot. You literally say anything. Stop.
That's actually kind of a fair. Do you think that because he was attractive, he was just like, I'm sorry that you went through that? And she's like,
He could have cracked jokes. It can be rapport building. He wasn't. He probably wasn't
I
trying
can
to sleep
laugh
with
at
her.
Women who aren't funny. They're hilarious if they're hot.
you have got to reel it in, dude.
Yeah. He's a young hot doctor. He's dating. He's not fishing around for his patients.
Oh, no, of course not.
Only 3 Zoom sessions in, she had asked if she could start using his first name during sessions. Already red flag. I mean, you can call me doctor. Can I just call
I
you
don't.
Mike?
I don't.
Michael,
I don't mind.
please. Also, you know what? Michael's one of those names where I'm like, it's perpetual. You're like,
I prefer the military honorific of doc. Anyway, like, hey, what's up, doc? That's my preferred way.
Yeah, do you like that?
Well, Edward seems a little too. I find they don't like calling me by my first name. And Dr. Perin just seems too sterile to me, so I prefer Doc.
Yeah.
I'll call
Perfect,
myself
Doc.
Dr. Perin, but I don't love it.
So I see you already called out three red flags that should have been raised by Dr. Mike.
Well, so he gets to be the one punished for it, right? Because she's posting her side of the story on social media. He's not. And this is part of the job. I cannot stress enough that erotic transference is one of the most common transferences that shows up in a therapeutic relationship.
Right.
And we deal with it. Like ideally we don't hide from it. We ourselves are brave enough to go, this is probably an erotic transference. I'm not going to shut it down to like shame you or make you feel ridiculous for having those feelings for me. Like nothing's going to happen. Like that would ruin our therapy. But like, let's talk about it. Like, I actually want to understand what it is about me that's making you fall in love, or what it is about falling in love with somebody that compels you to behave in this particular way. I'm curious. I'm not going to shut it down, nor am I going to act on it. I'm wondering what it's about. Tell me more about it. Tell me more about it. Tell me more about it. And if it ever comes to like push comes to shove, where she's like, let's act on it. No, I want to clarify that right away, really early on. That will never happen. I will not act on those beliefs, but to not talk about them will interfere with our therapy. So let's talk about it.
Yeah.
He might have done that, but we won't know that, right? Because if a patient is angry, I'll pick on myself, right? I'm much more likely to write a Yelp review if I had a bad experience. If I went to a mechanic who wouldn't see my car, I would, and I went to another mechanic who worked on my car, I'm writing an angry review of the other mechanic while my car's getting worked on, right?
Mhm.
You're less likely to go out of your way to write a good review.
Of course.
So he may not be doing anything wrong. She could just be going home and posting 1,000 TikTok videos about how terrible he is.
Boy, Dr. Mike, you're in for a ride.
Michael. That's not grown man. You say
Probably
Mike.
isn't his first ride. Probably isn't his first rodeo.
Wait, is Mickey as short for Michael? Well, but then again, how are you supposed to say no to that? If you're that formal 3 sessions in, oh, yeah, you can call me. Like, I'm thinking if someone's like Dr. Hancock, and like, can I just call you Hunter? I just want to see why not. Reading it, I'm like, red flag.
Yeah.
But if I was there in person, I'd probably be like, for if he didn't. Oh no.
This message is sponsored by Raycon. It's back to school season, and around this time, I'm thinking of starting fresh. That means new.
You ever use
new
Raycon?
clothes. Definitely. New Year bomb.
If we start doing ads like this, am I going to be the one who raises his register and makes faces, or are you going to be the one?
Oh, I am very happy.
Earbuds.
I am very happy to be the
Where? And there's a cure.
the clown in the show.
In service to this, I do want to remember that in thanks for you helping me make this show, I bought you a PlayStation. So Sony, sponsor us maybe, and then let us.
Sponsor.
And now that I've officially told you that I have bartered for your help with this Sony, I might be able to write it off on my taxes.
Oh, amazing. Me open. Man, I used to like in-ear headphones. It just hurt. They hurt my ears now. I don't know. It might be
They've
one
always
of those
hurt.
things that
They've always hurt my ears. I
so
like.
I'm
I
always
like
over
the
it.
outer ear.
Look at these big old cans.
Yeah, Bose has a good one. Bose sponsor us. I'll wear your earbuds.
Be with himself, because this friendly attitude was clearly a clever ruse.
I said, "Hey, do you mind if I call you by your first name?" And he seemed so smug and happy with himself. And I know that that is because that was his first sign that him pretending like we're friends was working.
Which I like this because it's like she's the one who initiated it. And he's like, okay. Kendra expresses
know
that
it for
Dr. Michael
sure.
is constantly digging his claws deeper into her intentionally, to the point that she would overanalyze every single interaction and mannerism as a calculated move. For example, Dr. Michael had asked her if she had, quote, any thoughts of harming herself. What seemed like a normal question for a mental health professional to ask
we
was
have to
apparently
ask.
much more than that. She claimed that he asked her this like, quote, she was special to him, reading way too much into a person being soft-spoken and kind.
And he said, I have to ask this because it's a special interest of mine. But is there any thoughts of harm? Like I was special to him. And he didn't ever ask me a clinical question again.
Which I've been to like a therapist before. That's like one of the first things they ask. That's like right off the bat. Maybe the times are changing. I just remember like right away they're like, what are you talking about?
Man, it's like
At this
it's
point,
usually
it
asked
sounds
3
like
times
Kendra's
before
the
you even meet
psycho.
with the
Yeah, of
therapist
course.
and screeners.
Yeah. Well, here's the
Right.
thing is the as you go through these, and I'm sure as we've seen so far, we're getting all of this in hindsight. So at this point in her recollection, I can tell that she's like really likes the psychiatrist. She's like, Michael is someone I could see myself falling in love with. So like, oh, why would he do this? It's the kind of thing where it's like after the fact where it's like, well, why would he do this? He was so manipulative. I should have, but in the moment she's in heaven.
Yeah.
She's in love with this, right? Once again, we're getting it all in hindsight from one person's
Yeah,
perspective. Maybe there is legitimacy to say.
I'm actually going to give really good advice here. Not if you yourself are on the receiving end of some degree of an accusation, or someone's telling you what your intentions are, or they're speaking as if they have insight into your inner world, and it is something that you have never done, have no intention of doing, and has maybe never even crossed your mind ever in history, they probably are doing it, have done it, or are planning on doing it themselves. And that is often a transference, right? So what she is accusing him of is these calculating manipulative behaviors, but we need to look at her calculating manipulative behaviors because it seems like she's trying to seduce him or to elicit a sexual response in him, while simultaneously accusing him of doing that for her. So this is the important part of working with transference, is that we feel it. And anyone who's been in kind of a tough argument, I don't even want to say a bad relationship. Sometimes people say the meanest stuff in the heat of an argument with a good partner, but what comes out of their mouth is a transference. And it's like, oh, you do this because you're green and like clubbing baby seals. What? That's so, I have never ever considered that in my entire life.
Yeah.
That is usually a flag that goes up that a transference is going on. First of all, what is it that I did that make you think that I club baby seals? And who do you know who clubbed baby seals in the past that I might be reminding you of in this moment? Like, I want to know. So that's the piece that I'm picking up on here. What she accuses him of doing moving forward may parallel her own intentions or her own relationships.
Very interesting. Definitely an angle that I didn't even consider.
Some of it, but as it's reading right now, it's a little much, is what I gotta say. Supposedly because he would switch from being vulnerable to cold and clinical with her, this was him purposely trying to make her desperate to receive validation. In reality, Michael was likely being cold and detached at the time to establish a professional distance and keep sessions productive.
She was
AKA
probably
she
looking
was
for
laughing
validation.
at things that were probably, there
That
can be an
she
element, there's
herself is
times where
sexually
the human
attractive
mind will make it
to
seem
him.
like the only way out is through self-harm and stuff. She's like, yeah, well, that would be me. Michael, you're crazy. Okay, yep. Pushes himself back a bit. I could never be a psychiatrist.
Why?
I just wouldn't have the patience for it. So, because if someone was doing this stuff, I'd say, moving on. Let's talk about your dad. I'd get too upset.
Then they'd leave a bad Google review and there goes your business.
Which, honestly, it's probably for the best. If I can't handle that one thing.
You were getting Google reviews?
I don't care. I'm like I said, you're either gonna get glowing reviews or you're gonna get the dirtiest reviews ever. No one's ever gonna say he's an adequate therapist. He's good
Sure.
enough, or he's worth what I pay, I guess.
Yeah.
It's gonna be they are the smartest, most brilliant, most wonderful. They could cure cancer with the right words, or they are manipulatively grooming me to, and they're switching between cold and calculating to wanting validation. That's likely her, right? So what I'm picking up from that, and I don't know, of course, I don't have a crystal ball, but I would presume that she is alternating in her sessions from being very warm and flirtatious to maybe being cold and aloof, hoping that he will come forward to try to validate or comfort her in a particular way. And I don't know if he does or not, but she's coming in with an intention. She's coming in with a relational goal. I want him to feel something by my presence.
Just like playing the game, the relationship game, right? Well, now I'm
She's
gonna be
playing her
smart.
game.
I'm gonna, yeah, she's playing her
Yes.
own game. Yeah.
And if he is a competent therapist who is very well trained in transference, he will be able to reflect that. And he might even be able to say, this is what you do. You alternate between being very warm and affectionate and then very cold, hoping that somebody might come forward and comfort you. I wonder what other relationships in your life may have led to that behavior. Or if I were doing empty chair work, get a chair for someone in your life who didn't come to you when you needed them to, right? And then it'll like, oh no, it is my dad. My dad was very would like, I would cry in front of him and he would tell me crying's not okay, or he would get up and leave because he didn't know how to like soothe me, right? Suddenly they're in tears. Now we're doing therapy. So it can start with erotic transference and it can turn into what is the actual transferential relationship. Let's go there. Let's work through it. Let's stop talking about it and let's start healing it.
So we can actually, channel this into the right direction to turn this into growth and healing.
And not a bad Yelp review.
Right.
Probably meant to, my practice was meant to begin with. But still, is Michael being professional is like, all right, because she's just like, you would look good in like a tank top. And that's probably why he had to distance himself and be like, okay, maybe let's just focus in on this. And she was like, what exactly is this game? You get called bad cop. Bad cop. He embodies both. Oh, and Michael's so charming. Kendra soon became obsessed with Dr. Michael, claiming that him being in Pisces made him a great listener. which anytime you hear anybody bring up zodiac stuff, run for the hills is what I got to
Red
say.
flag. That's a huge red flag.
It's a huge red flag. And I hate when someone says, you're a Capricorn. Well, first off, they say it in a way where, as if I'm supposed to know. And then I say, what does that even mean? Because it's a trap is what it is.
Yeah, I am a Pisces, but I don't know what that means.
You do. What does it mean? And they immediately jump into what it is.
Well, I've had someone say like, "Oh,
You're just a
Taurus."
water sign. You go with the flow.
Perfect.
I'm a Scorpio, and I
think we
just
are.
use that as an
Heartbroken
excuse
about
to
it.
always be in the water. I'm a water sign.
You see,
Yeah.
I only
You
just
are.
recently learned that Scorpio was a water sign. When I think of scorpions, I don't think of water. I think of deserts. No, they're a water sign.
Fucking bullet there, buddy.
Yeah.
She soon began begging to see him weekly, which Mike rejected. Michael said,
Yeah.
no way.
Yeah.
It's probably built up. I bet you he's been talking to people too. I have this one client that is just a lot.
Well,
And then you get the-
that is
starts saying
correct. He
weekly.
should say no, but he should also say, I
too.
wonder if this is related to this funny dynamic that's playing out between the two of us. I'm wondering if you want to see me more because you enjoy seeing me, and then talk about it, then see what comes out of that. And you can say, well, no, I'm not going to develop romantic feelings for you, or no, I'm not going to increase our session frequency because I'm your prescriber, I'm your med manager, right? But he would at least be able to work with it instead of the no, right? Because that can create the firm rejection, right? Because you can, the transferential relationship, you're not just replaying the relationship, you can replay the rejection trauma.
Yeah.
And if
Well,
you
w-
replay the rejection trauma, you can be angry and you can hate your therapist.
We also got to remember that we are, his video, his script, and our reaction right now is entirely predicated on her account of the story, right? Up to this point. So we don't know really what Dr. Mike said as far as like, no, or maybe that's not the best. I don't know. We don't know really what that interaction was. At the
But
time.
but this is what I'm saying about very often you're listening to beyond the communication, what she's saying and what she's not saying beyond the actual words. This is what I mean by when she accuses you of something that you have not done, were not, will not do, had never planned on doing. They are doing it. They have done it, or they are planning on doing it. Like when the transference is going on, they are communicating a relationship. That could be a relationship between them and themselves, but very often, it could also be two other relationships that they're observing, but very often it's their relationship with another person. So when they're talking about, oh yeah, Dr. Mike is definitely doing this on purpose, and his plan is that, she is talking about someone who she in the past has had that kind of relationship with. Hypothetically, it's a romantic relationship between Dr. Mike and her relationship with her dad, because the dad is very likely the primary trauma. It's very likely an arrest in development because of her needs not being met by an opposite sex parent, in this case, her father. In our case, it's often the mommy issue, right? Most men in our primary trauma is with early, almost non-verbal, pre-verbal relationships with mom. In her case, she is trying to replay earlier relationships. So as she's talking about this relationship dynamic, she is inadvertently broadcasting past relationship dynamics. And I'm hearing it as she's speaking. I'm hearing her dating history. I'm hearing her father-daughter relationships.
Now, I have a question for you. How much as a psychiatrist, like, that we've established that our primary
Physician.
the
Yeah.
physician clinical, role, will actually try to dive deeper into that, and is it the course of action to then refer to a therapist in tangent and in parallel with the maybe whatever the medication prescription role that the psychiatrist
Right.
has. So is the psychiatrist going to take on that role as the therapist when he is more of a physician?
If he's trained in it, yes. And I want to even go further. If he's classically trained in psychoanalysis, this is a tradition that has been passed forward for 125 years. Like this is a deeply established wisdom tradition of psychotherapy since the late 70s, early 80s, not only has that been been removed from medical training, but it has been replaced with these brief manual focused cognitive behavioral psychotherapies that are really anchored in education and skills training. Oh, well, here's a lecture on what smoking does to the lungs, and here are 3 skills you can use to overcome a smoking craving, right? That has become the method of psychotherapy. So even if Dr. Mike had gone and taken additional psychotherapy training, statistically, he would have sought that kind of training and he would go, "Oh, let's get a worksheet out and you can, challenge some of these beliefs about me and how I feel about you."
Yeah.
That wouldn't go very well. The classically trained, which is more of a relational psychotherapy, it's what's going on in the room right now between us? Can we look at that? Can we look at this objectively? And can we maybe see how that is showing up in earlier relationships or other relationships in your life? Other people might be like, "This is weird that you're flirting with me. This is inappropriate. I'm going to end this relationship. We can't work together anymore. Or I can't be your attorney anymore," right? A therapist or a well-trained therapist is gonna stay with them. We're actually not gonna abandon you over this objectively weird thing that you're doing. I'm actually going to help overcome it with you so that you're not creeping on your next psychiatrist, so you're not creeping on your podiatrist or, God forbid, your CPA or whatever.
Sure. Yeah.
I hope I'm making sense.
No, yeah, of course.
Also, he was just like, I have no time. I have all these other. I say you don't want it because I can make that work in my schedule. It could be that too.
Yeah.
This obsession began to escalate when Kendra was a victim to a horrible car accident that left her with a serious bruising and a perforated eardrum. Despite the doctor insisting that she needed emergency care, she decided to delay it in order to make her session with Dr. Michael the next morning.
I had bruising on my abdomen and a perforated eardrum.
Yeah, she wanted
The
sympathy.
provider at the urgent care
That's
said,
that's a
"I do
father
not feel
transference.
comfortable
I want him to
treating
kiss my
you. You
boo-boo.
need to seek emergency care now."
Interesting.
But
No,
it
I have to
was
wait
looking
till
into the
daddy
months,
gets
and my
home. I need
appointment with my
daddy to see me, and
psychiatrist
then
was
I'll
at 2.
cry, and then he'll
So
kiss
I
my
decided
boo-boo.
that I was going to wait so I could see my psychiatrist and not have to reschedule because I was looking forward to my appointment with him so much.
Yeah.
Can you imagine? Can you imagine the next
Yeah,
day
that's her
logging
dad.
in and there's just like a person with a huge swelled face and a fucking blown out ear?
Sweet.
Rust. Yeah, that's what she wanted. She wanted him to see her like that. He probably would hope that she was still bleeding
should
so
go to
she
the
could see,
hospital.
so he could see her bleeding.
There's no way. I guess is what we're trying to get at. She even told him this, adding that she may very well be bleeding internally during the session as they speak.
Yeah. Cracked it.
When Charlie Murphy kicks Rick James in the chest and he does, "Man, my head's bumping," after they reconcile. And then Rick James is like, "Now that you mention it, I think I'm bleeding inside my chest." What do you think of that? Kendra had officially fallen for her psychiatrist, spending lots of time during sessions explaining that she had intense feelings for him, hoping for him to reciprocate. He would not do this, and Kendra later stated that, quote, weaponizing neutrality was, quote,
Yes.
his favorite.
So this is the mistake. I have these feelings for you. I fantasize about you. I think about you, coming to me and I think about blah blah blah. What do you want me to do? How are you imagining me responding in these situations? You're coming up and you're scooping me and you're kissing my boo-boos, or you're telling me I have these feelings too. I've always cared for you. I just couldn't because, oh, my profession, I gave my oath and I can't. But yes, you are special. You are wonderful. Let her say that. Let her actual put words to what her fantasy is. He can say, "I can't do that. I will never do that. That goes against my professional relationship. But let's talk. Let's understand this. Why do you want me to respond in that particular way? Why that way? Why do you want me to why do you want me to confess in that particular way?" That is curious. I want to know. I care enough to want to explore this with you.
We have a question in chat.
Oh, yeah?
When, if ever, is there a right time to terminate a therapeutic relationship due to transference?
Well, I would draw the line on sabotage, right? So if she is posting videos that are destroying my reputation, I would draw a line on that. I would try to resolve it. I would try to have a conversation, but if she is actively like trying to sabotage, I will take steps to protect myself. And that even includes our patient-client confidentiality. There are conditions in which that ends. If I have to defend myself in court, I will be divulging information to protect my license and to protect my profession, up and including a discussion about what erotic transference is and how it wasn't navigated very effectively.
Yeah.
Hitting is my biggest no-go. If you touch me, like, the therapeutic relationship is over. But that can be a transference, the anger, the aggression, and the hitting.
Thank you for the question, Maxis. Good stuff. Yeah. Great question.
Game to play.
Weaponized neutrality was his favorite game to play, right? He didn't disagree with Brianna telling me that my psychiatrist had feelings for me, but he also didn't say that inappropriate. Let's change.
This is where
We should be able to talk about it.
stuck around.
Yeah.
That's scary.
Wait, as a psychiatrist, can you be like, I don't want to see you anymore? Like you're.
I think you can. I don't know why you couldn't. All the while, she would send him emails about her crush for him that were riddled in heart emojis, despite having a boyfriend for a period of the time. That old boy.
Yeah, I'd talk about that. The heart emojis are inappropriate. I wonder why you felt the need to send them.
Yeah. Oh, you're with Mike? That's awesome. Yeah, I think we'll just be more happy. Hey, no, totally. I get it. Go be with him. He's your real love. He's like clicking his heels, like running on. Down, just leaves a shit. And she unlocks the dog collar off his neck. Oh. She then discovered that Dr. Michael was withholding a diagnosis from her, specifically other trauma and stressor-related disorders. Uh-oh, she's just like, just the ADHD. Now he's saying I'm a fool.
Well, there's a relational component to trauma, especially childhood trauma. PTSD.
I met he didn't tell her in the middle of the night.
Exactly. She's crawling through the fucking window. She's like, I bet he has his love letters for me in my notes. It's just a full blank page with one thing at the title that just says, this person needs more help. According to Kendra, this was him secretly using her mental condition to manipulate her. He didn't even tell her that, though. The fucking bitch did sneak in. I don't know. I mean, it's got me nerved up, dude. I'm like,
you're legally the owner of your medical records.
Can withhold
of your own
information
medical
to avoid
records.
dishing out labels to patients that may worsen their condition. It's just a way of like, why overstress somebody? You already have ADHD. If I'm just like, hey, I think you have multiple personality disorder or something, is that going to make the other thing even worse? You know?
Yeah. I was gonna say you don't want to be like, oh, they have signs of this, but like I need to dig further before saying
Even really diagnosing it, right?
because I had my therapist think I was gay, and that put me through a lot of stress.
You bring that up a lot. You do. Which I want to say, someone just telling another human
Homosexuality
being
has
gay,
not been
I'm
a
gonna
mental
say,
disorder
is-
since the
is in
DSM-2.
a professional sense. That's a power move. I've never seen one. If anything, was that with a woman?
I don't think it's been considered a mental illness since the 60s.
Flirting with her?
No, I wasn't. We were combating all the time. It was a very toxic relationship with it. Well, I was just like, because I was doing it for like anxiety. I was talking about like psychedelics as a way to deal with stress. And she's like, well, that's not proven. I was like, well, I've seen studies. And she's like, well, I have other studies too.
You have to do the
Every
inner work.
thing
Don't just
should
eat
always
shrooms.
Yeah, counter it with something like either I was wrong or that she was
Shrooms are
So
great.
you were like, I have studies.
Got to do the inner work.
I have studies of this working, okay, to a doctor. Her rebuttal was, Nick, put the knife down. And then you said, and you're like, I think that we could be married and we could be happy. And she's like, no, you remember you're gay. You're a gay man. Remember that? And you're like, stand in the corner, just,
I came in for anxiety and she's like, we're going to treat you coming out of the closet.
feel anxious. Do you also think you should do something else? What if it's a power move? I'm feeling
Unfortunately,
for she's like trying to overbear you.
Well, we have talked in the past that, unfortunately, not all psychotherapists are great psychotherapists, right? There's people out there that are not necessarily doing a great job or are
Yeah,
particularly qualified to be in a
lower bell
position, right?
curve, very lower bell curve. If they're trying to impress, if they're trying to convince somebody that their anxiety is stemming from not fully embracing a sexuality, I don't know. I haven't evaluated the guy, but that just seems like a weird thing to talk about in therapy. Again, it could be just a joke in the first place, and I'm just making a mountain out of a molehill. But
Yeah. I mean, it is a topic, so I don't think it's worth mentioning at least.
oh yeah,
Keep me there.
Mission success.
Yeah.
I would say that is very unprofessional, though.
Yeah.
I wonder if she still has her practice. She'll see.
We'll put it in.
Let's
the
blast her here.
Yeah, we'll blast her out.
Anyways, where are we at? Kendra would vent to Michael about how her boyfriend didn't meet her needs, claiming that her psychiatrist insisted that she stay with him because, in her mind, he was trying to make her rely on him to fill those needs, which is kind of so. Michael's saying, you got to stay with him. I think Michael's definitely kind of going out of practice here to be like, I will do whatever I can to have you feel like you don't need this anymore. He probably was fucking afraid.
She probably was saying like,
Oh, he
"Maybe I need to
probably
break up
was.
with him and date you, Dr. Michael."
Exactly. Where
he
he's
probably knew it.
Well,
He probably
don't
knew
wanna
that
do
that's what she wanted to
that's
hear.
not going to work out. I think that you really,
Oop, sorry, I don't know what that keeps happening.
you like your boyfriend these days. This cat and mouse game, Dr. Mike. Stop it. When Kendra had been having sex-related issues with this boyfriend, Kendra decided to go on a 30-minute excruciatingly detailed info dump about her sex life with Dr. Michael, which she secretly recorded, making it a point to reiterate beforehand that she also had a crush on him.
Yep.
I said, today we're going to talk about my intimate life. And then I proceeded to give him 30 minutes of non-stop content about my intimate life with my boyfriend. And I actually recorded the whole thing because I was so excited about it.
Oh,
So
Question for you, real quick: Is this
Yeah.
is this like a very extreme case?
well, yes.
Okay.
Most times this can be resolved before it becomes a TikTok series. But again, what I said earlier is that when people talk about a relationship, they may be subconsciously communicating a different relationship. So while she's saying I went into 30 minutes of excruciating sexual content about stuff with my boyfriend, what I'm hearing is that she spent 30 minutes talking to Dr. Mike about her sexuality, maybe fantasizing about how she would like to have sex with Dr. Mike. And Dr. Mike is probably not dumb. He graduated medical school. He's probably sitting there the whole time going, "Oh my gosh, she's trying to talk about her sexual fantasies with me." Now, again, classically trained therapists who are trained in transference and countertransference work are rarer these days. They are much harder to come by. So if he were trained the way I was, I'd be like, "Oh, great, let's work with this." He could be like, "Oh no, I don't know what to do with this. This is bad. Let me tell her, stay with your boyfriend. No, that's inappropriate. No, I can't talk about this. No, let's change the subject." All of which would not be very good interventions. I wouldn't recommend them as therapeutic interventions if I was supervising Dr. Mike as one of my trainees. But yeah, it's possible that he just did not know how to deal with the transference, so he was putting up a wall. He was telling her, "No, let's not talk about this. Let's not go there. Maybe you should stay with your boyfriend." So I am saying it is possible that he's not doing good therapy, but I highly, 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 highly doubt that it is as she is painting it.
Sure.
Psychiatrist was like, "Yeah, I don't know. I think I'm just still dreaming about you. I think that we could be really good together." Well, my boyfriend doesn't know how to clean these pipes. Got cobwebs all up in there. Wish somebody could help me with that. Dr. Mike, you got thick fingers. These are fairly normal fingers. I bet you I could get all the way down to the knuckle. Next time she comes in, he has like gloves on. He has the oven mitts on. All right, let's see if we can get this hour done with this hell that I'm in.
But
Michael
avoiding
looked down and smiled
the
to himself at the
conversation
reaction to
is
the
not
insane
therapy.
thing that was just taking place. And Kendra asserts that this was because he was internally celebrating, since he had been grooming her for 2+ years to get this intimate sexual content out of her.
I was just gonna say that seems like a long time, I mean, my other question is, uh,
2
that
years
seems
of
like a lot.
monthly, once a month. That is only 24 visits.
Yeah. Okay. Well, so okay.
That is only 24 visits, and it's possible that he was only meeting with her for 30 minutes. Like, she was it's probably even less than 30 minutes. She's probably
Mhm.
being scheduled on a half hour, but it's a 20 or 25-minute med management session. Like,
Mhm.
he is probably just dealing with explicitly med management. Coming in to deal with her non-stimulant ADHD prescription, and then as he's identifying a potential PTSD diagnosis, what, if at all, he would change about her medication regimen. That is probably what he's thinking in a 20 to 25-minute, once a month med management session.
Kind of fault him a bit for not saying no to this,
Yeah.
right?
Money.
He's probably
Well,
saying no to it.
Lucrative or something.
He's
I
probably
don't know.
saying, "This is weird and I'm uncomfortable,"
The
instead of
pieces
doing
are stacking
therapy.
up to where it's so ridiculous to where you're thinking, how could this man stay?
Maybe he was forced to. Maybe he begged. Please, I don't want to see her.
It would be unethical to fire her.
Give me a sign, God.
He's probably trying to treat her.
That's what she
He's
comes
probably
up
trying
with
to help her.
something.
Poorly, but he's at least trying.
After breaking up with her boyfriend, oh God, Kendra starts dating a man who is a therapist that apparently was so sexually attracted to one of his clients that he often masturbated to get it out of his system. Kendra decides to share all of this with Dr. Michael, who responds by looking like he'd seen a ghost and appearing like he was going to throw up. It is
Yeah,
a
that's
pretty funny
weird.
thing to just be like him, like being like, what she probably read as he's jealous.
Yeah.
While this could be explained as a normal response from a psychiatrist to a repulsive malpractice, Kendra later determines that he was actually terrified that she was holding up a mirror to him and revealing his similar predatory actions towards her. He's like, I have not once thought of you in any
Her
capacity
desire for
outside
her
of this
him to
office.
predate her.
Talk to me too.
You're probably beating it right now, aren't you, Dr. Mike? He's like,
She
yeah.
she wants that. That's her wish.
I've had
That's
mints on
not
for
her
the past
fear.
6
That's her
months.
wish.
Oh, I bet you're just fondling all the goods down there, aren't you, Dr. Mike? You sick fuck.
Do you think this is a fake boyfriend?
Yeah,
or
that's
she just
that's
made
not that's
I
not
think that's
it's not
suspicion.
fear.
That is
That's not a
like-
phobia.
Yeah, I
it's
don't
a
know. He's also a
philia.
psychiatrist, and Kendra discovers that Michael does in-person sessions too. So she pushes the next one to take place in his office. She wears a dress and does her makeup real nice for their first encounter, greeting him by charging at him and hugging him as he awkwardly pats her on the back. I'll admit it all. He's actually in one of those like Halloween sumo suits too. At this time, Kendra started engaging in lengthy conversations with ChatGPT about her relationship with Dr.
So
Yeah.
he agrees to in-person consultation. How is that in the context of what's already happening? How is that seen, or what do you think of that?
Well, I guess this is new information that they have been doing telemedicine sessions allegedly.
Yeah, they have been
for some
doing it
time.
has
Yeah.
been telemedicine.
So all of the flirtation has been through video. That's
Mhm.
weird.
Yeah.
No, I don't think it's uncanny. If he had an office in town and she would prefer in-person visits, that's fine. If she was like driving in from out of town or like, traveling 40 minutes to visit in person, that's probably another deal. But what's really resonating here is that she had a plan. She wanted to go to his office to seduce him.
Mhm.
And if you're trained in this, again, this is very valuable training. You work with it. You go, you don't normally wear this much makeup on our video sessions, or you chose a very revealing dress. I wonder if it's because you wanted me to see you in this dress, or how do you picture me responding to you with a red revealing dress, right? I picture you sweeping me off my feet and telling me how wonderful it is to see me in person. Okay, let's talk about it. I won't do that, but let's talk about it.
Mhm.
Like the whole thing is the willingness to talk about what is going on in the room, in the moment, is the therapy. and I am guessing he is uncomfortable and like, oh gosh, get her out of there. And his inadequate training in transference is probably it's probably getting her to keep it keep it going. Like she's not working through it. She's doubling down and she's trying harder to seduce him.
Yeah. Yeah.
Mike. She would refer to him as Henry and often took what he was saying far too seriously with the chatbot. At one point, the AI chatbot explained to her what transference is. Transference is where people inadvertently take emotions and desires from someone in their
There you
past
go.
and put it onto your provider, right? Your like health professional, something like that, or someone that you talk to. This can often affect people that have abandonment issues. In this case, Kendra may be lonely or pained from a history of strained relationships, leading to her falling for her psychiatrist because he is being warm to her, right? Being kind, communicative, and non-judgmental. So it
The most
makes sense
common
that
thing
he
that
would be
happens in this
I
work.
feel this way because I haven't felt this way in a long time. I'm not saying that it's like abnormal or I can understand how someone would get there. But goddamn, Kendra, fucking pump the brakes just a bit. Kendra claims it was grossly inappropriate for Dr. Michael to be aware of a concept like transference and continue seeing her knowing she was likely going through it. It's a
Well,
fair
we don't
point.
know if he was aware of
Why
it.
would-
He's a
even if
physician.
I was mentally unwell, why would you keep seeing me as a patient? I'm a psychiatrist. It's like in a later session, Dr. Michael seemed to become a bit agitated with Kendra when she insisted the two of them to have a very special patient-doctor relationship, which he sternly asserts that it is strictly professional. Once again, setting clear boundaries. I love that.
Correctly.
After
Yes.
all that too. I think it's really fucked up that you're taking me on as a patient like this. And she's just like, we should climb a tree and carve our initials into it. You feel how special this is? He's just like, oh my God. I would lose my 2 years of this?
Yeah.
My fucking God. Over time, Kendra felt like she was improving with her confidence after rejecting her now ex-boyfriend when he sent her a series of texts begging to have her back. Dr. Michael praised her for standing her ground.
Yeah, good for
Kendra
her.
analyzed in a strange way. That's odd. Hey, that's actually really great. That's a great step for development.
Oh my gosh, he affirmed me. What is his angle?
The silly games we play. I don't think she's in a loner room, like clicking the light on and off. Listen to opera music. Dr. Michael was struggling internally, apparently, because he loved seeing her become a stronger person. But that meant that she would soon become a threat to his supply source, aka his ability to drain her vulnerabilities for his sick fantasies. Becoming strong.
I think people.
Devil she was.
So I actually think this is probably a good time for us to maybe pause it for now, and maybe we can finish the reaction video at a later date. But like, I genuinely hear this a lot that like, oh no, they're manipulating us so that I keep coming to therapy. I don't think people understand exactly how much business we get, like how many inquiries we get a day, let alone a week, let alone a month. Like when we graduate you, when you're healthy enough to go on and be your own therapist or to not have therapy anymore, we have 4 people who want that hour slot. Like it's fine. Like we are okay letting you go out and into the world. We just want to make sure it's right. Like we want to make sure that this is the opportune time. Like you're in a great place. Go out and live. Yeah, there's a comment. I don't know a single psychiatrist who is concerned about finding patients. I have not advertised my psychotherapy practice in maybe 3 years. I have a Psychology Today profile and I have a website with a link to like my email, and people just email me and they say, "Hey, are you taking patients?" And either I am or I'm not. And I'm just, we're not spending our time trying to like, how do I keep them in for one more week? How do I get one more billable hour out of them? That seems like such a silly thought, but I hear it a lot that it's a coercion or a manipulation tactic. Like, no, we're trying to help you.
Well, yeah, I think, listen, there's still quite a few minutes left of the video. We're gonna have to finish it. And I think, maybe we're gonna do something else for the next episode. But spoilers, it ends how we all think it's gonna end, right? They quit it, but this woman, no, it wasn't before she actually called him out by name on one of her 50
Dragged him on social media.
TikTok
Yeah.
things, and that's actually when it all kind of blew up. Because I think people started kind of like doxing him or something, and people were, of course, there's a lot of people aligned with her in social media, and they were going after him. I think
Well, if they
it just
believed her,
totally snowballed into something. I mean, it was
if
actually
she
pretty
were if
damaging
she
to
were
the guy.
telling the truth, then like yes, get him out of the profession. It's just I don't think she's entirely accurate in her perception of the situation. But this was to answer that earlier question, like when is it an appropriate time to fire a patient? Like this is the limit to the confidentiality. If a patient is broadcasting and sharing intimate details or even privately recorded moments that were carefully chosen out of context to make a therapist look bad, we have to say, I did treat them on these dates for this condition, and these delusions or these transferences are part of what we were treating to protect our business, to protect our license, because this can go to our ethics board. We can go in front of our licensing committee, and they will ask us, and we can't go, hey, patient therapist privilege. They are trying to hurt me. They are trying to ruin my reputation or physically harm me. The limits of confidentiality are met. They are reached. There are no, like, you have reached the limit of the confidentiality. You're trying to harm me.
Mhm.
I I think therapists aren't very comfortable talking about this, but it has not happened yet in my career, knock on wood, it won't, but I have seen it happen, and it is most likely to happen with severe personality pathology, primarily what we call borderline personality disorder. What is very common in borderline personality disorder is an ego defense called splitting, which means someone can be all good or all bad. If you're the all good therapist, it's great. Honestly, it feels like $1,000,000. Oh, you're so brilliant, Dr. Perin. Oh, thank you, Dr. Perin. Oh, another great transference interpretation, Dr. Perin. It feels great. I know
Mhm.
it's not good therapy, but it feels great. When you are the all bad therapist, it's terrible. It sucks. It feels bad. It's hard in therapy, but so long as they're still showing up and they're still working on it, we can take those punches. We can take those hits. We want to be there. Once it goes out into the public sphere and it ruins our reputation, like we have to take steps to protect ourselves and to protect our license.
Um, so what do you think? What do you think of this? What do you think of this video? I mean, kind of closing remarks here.
I think it is really good to highlight this both as a patient and as a practitioner, that our opinions about our therapist are not always accurate to the therapist. And if you have a good therapist, they're willing to work with our opinions, whether they're good opinions or whether they're bad opinions. They have a healthy enough ego, they can hold your opinion of them that's incorrect and work with it therapeutically. If not, well, it could get worse. And if you're a therapist and you're working with, populations with severe mental illness, like psychiatrists do, like psychologists do, you are at an increased likelihood of a splitting or a devaluation that can compromise your reputation. I I think it's good to be able to talk about it, and I also think it's one of the benefits of being in a group practice because, you can get the boss can get the hate-filled voicemail of like, "Oh, he was grooming me. Oh, he was coercing me." And you can pop your head in and say, "Oh, they have a borderline personality diagnosis and like, my reputation. I've worked here for 10 years." They'll be like, "Yeah, it's probably clinical, but like be careful," right? It's helpful to talk about this to recognize this is something that happens in the work. Like it is not just common. It will likely happen in your clinical career.
Yeah, great. This was fun. I enjoyed kind of
Yeah.
doing this reaction live and really hearing your thoughts on this topic and kind of getting your professional take and actually from. I mean, listen, Papa Meat is very entertaining. big shout out and total full credit to Papa Me for that awesome video. They're really funny. So I think I think it's important to kind of get a professional take on this out here, and okay,
Oh yeah, yeah.
what's real, what's not,
If you find more videos, let's do this again. This was fun.
Yeah, and for anyone listening to, if you have any videos like this that you would like us to react,
Yeah, send us reaction videos.
over. Thank you for the action in chat. Really appreciate the comments. Really appreciate the energy.
Yeah, especially
but-
Meraxis. Shout out
Yeah,
Meraxis. Lots of really good questions
Meraxis,
there, bud.
Great stuff, man. Thank you so much. So yeah, thank you, Ed, for sharing your professional takes on this. This was great. I like the spontaneity of it. Let's, we do have a more conventional style of our conventional style of video ready for, or stream ready for next week. But we are super open to keeping it fresh and to stirring it up and do something different like this. So for those listening out there, thank you so much for tuning in. Again, we go broadcast live every Monday at 7:30 Eastern, 6:30 Central, on YouTube, on X. Yeah.
And
And
we are
thank you.
sponsored by the Hopewell Institute. A lot of big rad things are in the pipes with the Hopewell Institute. We're a few weeks down the line from some pretty big reveals, but you can go to our website and join the newsletter now. Be one of the first to hear about it. I'm trying so hard to contain my excitement and blurt out what these projects are now, but they're really dope. I'm really excited about them. So go to www.thehopewellinstitute.com, join our newsletter, get on top of stuff. Lots of cool stuff coming.
Yeah, that's right. Thank you.
Thank you, Pablo.
Have a good night, everybody.
Bye-bye.